Hi everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, I'm going to share with you some top things that I would recommend for individuals who are dealing with persistent pain after knee replacement surgery. Now, when we talk about persistent pain or chronic pain after knee replacement, we're talking about that pain that is still going on and still lasting at a significant intensity months or years after you've had knee replacement surgery. Of course, most people are going to have pain and swelling and stiffness and all these symptoms early on after surgery in those first weeks and first months, and usually it gets better gradually over time. But for some folks, that pain is going to persist. It's going to persist at that same intensity, that same frequency for a prolonged time, many months or maybe even years after having surgery. So what are some important things to help you manage this effectively? Of course, there's all sorts of what we call multimodal pain approaches and pain responses out there, and you can use, whatever ones you find beneficial. So this is the things that, probably are very common to hear: ice, heat, pain medicine, pain psychology, things like meditation and mindfulness. All sorts of things that are out there, and it's absolutely appropriate and absolutely okay to try to use those things as a pain management strategy for you. But here's a couple of things that I would really want you to keep in mind. One is we want to understand there's a difference between pain and harm or injury. So there's a threshold that your body and your knee and your legs and things start to experience pain. And this is all performed by your nerves. Your central nervous system and your peripheral nervous system are communicating. The nerves through your legs and your knees are communicating with the nerves in your spinal cord and up in your brain to provide you the information of pain as an alarm system or a protection system for your body. So your body kind of alerts you to the potential for harm or injury. But the important word there is the potential. So what happens when you have persistent or chronic pain, either just in general or after a knee replacement surgery or any type of surgery, is that this signal, this warning alarm, becomes almost too good at experiencing pain. Your body becomes too good at experiencing pain. Or what we sometimes call it is your nerves and your body has become hypersensitive. So essentially what this means is the threshold of stress or strain on your system or the activity is such a low threshold to cause this pain that normal activities and normal things that should relatively be pain-free and not cause any trouble are triggering your nervous system to provide this alarm of pain and discomfort. So what can we do about this? What can we do to decrease this sensitivity and improve the appropriateness of when you get pain and when you don't get pain? What we have to do is essentially retrain your nerves and central nervous system to recalibrate to kind of what level of stress and strain on the body should lead to pain and this pain signal, and what level of stress and strain and activity is appropriate and okay, and you don't have to have this pain and this warning alarm. So how do we do this? We do this by movement, exercise, activity. And what I mean by this is you want to find kind of that starting point. We don't want to go 0 to 100. So the thing that I like to use is think about what activities, what things would you be doing if you didn't have these pain and these symptoms. And then think about how can we modify this activity to make it a little bit lower stress, a little bit lower intensity that you can start, and just start by trying this way. So for example, an easy thing to think about is if you enjoy walking or you enjoy hiking. Let's start at, I'm just going to walk for 5 minutes. And I'm going to walk for 5 minutes on a nice level surface with supportive sneakers, a surface that's maybe not too hard, maybe a grass or a dirt surface like a trail. And then the next day, if that goes okay, I don't have too much pain or discomfort, then the next day I'm going to try 10 minutes. And then I might try 15 minutes. Or I might try increasing the incline a little bit and doing a little bit more intense, a little bit more difficult terrain over time. And as you do this, it's okay to deal with some pain and discomfort, and it's okay to work through that pain and discomfort. Again, we want to remember your body is experiencing this pain threshold. It has this hypersensitivity. So even though you have this pain, you're not causing any harm, you're not causing any damage. It's okay to work through that low to moderate intensity pain and discomfort. As you start to get higher and higher, we want to find that right balance. We don't want to be too intense where you're going to cause a significant flare-up of symptoms, and that's just going to set you back until your body recovers and recuperates. So we want to find that happy medium where we're stressing the system, where we're retraining the body and the brain and the nerves, but we're not causing a flare-up either. And so another thing, for example, is if you're someone who likes golfing, instead of going out and playing 18 holes and walking the entire course with your bag, let's go to the driving range. See how that goes. Is that worked out okay? Okay, now let's take it one step further. Let's play 9 holes, but we'll take the golf cart this time, so we don't have to do as much walking. And then just building up from there, and you can do this with any type of activity. And then the second thing I would talk about with people who have persistent pain is let's take a look at your overall health. Pain is multiple factors play into your pain. Multiple factors, multi-complexity. And so let's look at your overall health. Are you getting adequate sleep? Are you having a good sleep environment, a good sleep setup? Are you eating healthy? Are you doing a little bit of activity and exercise, whatever that may be? And again, exercise and activity is whatever you're willing to do and whatever you can tolerate. It's whatever you enjoy and can be consistent with. Are you maintaining a healthy body weight? Are you managing stress? If that stress is from work or from family or whatever that may be, finding outlets to manage and deal with that stress safely and appropriately. And as you start to address all these different aspects, for many people, you're going to start to notice that you're going to decrease that heightened sensitivity of your knee, of your body, and you're going to experience less and less pain. Now, this takes time, it takes consistency, and it takes patience. So don't be too hard on yourself. Just take it one day at a time, one thing at a time, trying to make small improvements, small increases over time. And that's how you will kind of dig your way out of this hole of persistent pain and discomfort after a surgery or any type of persistent or chronic pain. I hope you found this insightful and helpful. Please be sure to leave your questions and comments below, and I'll be sure to get back to you. Hit that like button to help spread this video to other folks who may benefit from it. And thank you very much for watching.